Senator Kamala Harris has released her health care plan just a day before the next round of Democratic presidential debates in Detroit. Harris won't appear until night 2, but her plan will certainly come up on night 1 when Senator Bernie Sanders takes the stage. Harris's plan advocates for Medicare for all, but differs from what Sanders has called for. This latest plan from Harris comes after she faced mounting questions about how she would pay for the proposal and whether she would allow private insurance to continue. Let's bring in now Stephanie Ramirez in Detroit and Zach Friend in Santa Cruz, California. Stephanie is a CBS News 2020 reporter covering the Harris campaign. Zach is a Democratic strategist who also worked on the Obama presidential campaign. Welcome to both of you. Stephanie, let me start with you. What does Harris's health care plan call for, and does it address the questions people had about her position?
Absolutely. So her new plan introduced today is her version of Medicare for all that really has 3 key differences. And just to go through them, one is the transition period. Sanders' bill calls for 4 years. She wants 10 years to transition into a Medicare for all. She wants to raise the limit so that more middle-class families would be exempt from a middle-class tax hike. So Sanders wanted $29,000. Those families of 4 making $29,000 and less. Harris is calling for those families of 4 making $100,000 and less to be exempt from a tax hike. And then really the big one is where she would allow private health insurance to offer a Medicare plan. Now, she did not say what her 10-year transition plan would be estimated to cost, but she did offer a Wall Street tax and at least 1 other or 2 others to help make up that difference. So that's what she's offering today.
All right. So, Zach, I want to play for you what Bernie Sanders' campaign manager said in reaction to Harris's plan. Let's listen.
Well, she started with supporting Bernie Sanders' Medicare for all as a plan, and so we appreciated that. Now she's moved away from it. Unfortunately, I think we've seen 2 major changes, right? One is she's decided she'd like to privatize Medicare. She'd like to introduce more insurance companies into Medicare. Obviously, that introduces more corporate greed and profit seeking into the Medicare program. That's dangerous for Medicare in general. The second thing she says she wants to do is phase this in over 10 years. I mean, not in 1 term of a presidency, not in 2 terms of a presidency, but that you'd have to wait 10 years for people who've been struggling for a long time for care.
So now Sanders will not be on stage with Harris, but Biden will, Zach, and he is not a Medicare for all candidate. He wants to position himself as the candidate who will expand Obamacare. So, Zach, how do you think that Biden approaches this issue on Wednesday?
Well, I think Biden should just continue to be consistent on the issue. I think that one of the real challenges that some of these candidates are facing, and I think that Senator Harris has faced this on this issue, is as there's at least the appearance of a lack of consistency on this issue. So for Vice President Biden, who was intimately involved in the creation of Obamacare, which overwhelmingly is actually still popular, private insurance is actually something people do still overwhelmingly prefer with a public option. I think that he just needs to show a sense of consistency and then always pivot to who is the best general election candidate to beat the current president of the United States. And I think that that'll be something that could play well for him in the debate.
Right. And of course, we know that health care continues to be so important. A recent CBS News poll showed Democrats in early voting states care more about lowering health care costs than access to coverage. So, Stephanie, is that feedback something the Harris campaign is listening to?
Yeah, so one of the things that Harris is arguing, the campaign is arguing, is that moving to a 10-year transition would save money overall in the Medicare for All plan. But again, they didn't say how much they estimate that plan to be. One of the things, though, that she does say she's listening to, and she said today here in Detroit, was that she's listening to those voters, mainly those who are uneasy about losing their private insurance. She specifically mentioned the example of labor unions wanting more time to negotiate transitioning into a Medicare plan, a Medicare for all plan. So she says that she's listening. We asked if this was a message that she was trying to send right ahead of the debates, because this would pit her right between Biden and Sanders as they both argue on their plans. But she said she's just reacting to what she's been hearing along the campaign trail.
All right. So, Zach, several of Biden's rivals appear to be preparing to follow in Harris's footsteps by attacking him on issues from criminal justice to immigration. So what does a good night look like for Joe Biden if the others pile on?
Well, I think actually a lot of the other candidates are going to have more to prove in this upcoming debate, especially some of the second-tier candidates that are really looking for a breakout moment. But I would say that even some of the top-tier candidates that still haven't fully broken through on either general election polling in some of the key industrial Midwestern states or even some of the primary key industrial states that start at the beginning. I think that what Vice President Biden needs to do is obviously be a little bit stronger in this debate, but I ultimately think that there's less pressure on him, even though that may be counterintuitive, than there is even on Senator Harris, who had such a remarkably successful debate the first time. The expectations will be unreasonably high probably for her this second time through, and whether she can maintain that will be judged pretty significantly in the coming days after that.
Right, the bar has been set high for Harris. So, Stephanie, I'm curious about how Harris is preparing for this, because Biden has indicated that he won't be quite so polite this time around. Has that shaped how Harris is preparing for Wednesday at all?
Yeah, she was definitely asked about that today and responded saying that she is going to point out her differences, but that her mother raised her to be polite, and so she is always going to be polite. Exercising this today when talking about her version of Medicare for All, she did not slam Bernie for his plan and said she applauds him for pushing that conversation. But obviously a lot of people are expecting fireworks, which is why I asked her, since she already went up against Biden, if she had any advice for Senator Booker on the stage this time around, and she smiled. She gave him some praise and said he's fine, essentially.
All right. So, Zach, there are several Democratic candidates who are not polling so well this time around. Who do you think really needs to pull out a stellar performance to stay in the race at this point?
Well, I think that Senator Booker is one of the people that really needs to help get out of the 2 to 4% range. Same, too, with Congressman O'Rourke, who started with a lot of fanfare but has been struggling to really get a lot of support nationally. I think that there's some other candidates, Senator Klobuchar and a few others, that are really looking to break out. And then there's some people that are just now coming onto the stage, like Governor Bullock, that'll get an opportunity to introduce himself. But there's people that are on the bubble. Remember, you need 15% in these states to even get delegates. So if you're polling at 4, 5, 6, even 12%, it's not enough to get delegates, and somebody at some point is going to have to make a move that's going to put them in that top tier, or ultimately the math won't work out for them anyway, starting in January.
Right, and that's not too far away as election cycles go. Stephanie Ramirez and Zach Friend, thanks to both of you.
Thank you.